Did you know that simply keeping your mouth open can change the shape of your face and damage your teeth? In this video, I'm going to go over some of the dangers of open mouth posture. And I'm also going to go over how you can correct this. Most of us don't think twice about whether we're breathing through our mouth or breathing through our nose. But here's why it matters. Open mouth posture is when your mouth stays slightly open instead of comfortably closed at times of rest. By rest, I mean doing anything that's not physically exerting. So that's things like sleeping or sitting on the couch watching TV or even watching your kids. This open mouth posture has become more and more common, and it can really have some effects on your overall health and also the way that your face looks. So let's talk about how this affects your face. When you grow up, as your jaw is developing and your mouth is always hanging open, then your cheek will keep everything constricted and your jaw will grow in that vertical, elongated direction. And you'll tend to have this narrower, skinnier jaw and face. This is different from people who grow up breathing through their nose with their mouth closed, because when your mouth is closed and your tongue is resting against the roof of your mouth, then this is creating a stimulus for that roof of your mouth or your palate to expand and grow forward and wide in that U shape, the same shape of your tongue. This is one of the biggest things that contributes to jaw development as your jaw is growing. It's this correct mouth posture. Ideally, our teeth should be slightly touching, our lips should be closed, and our tongue should be resting against the roof of our mouth. Not just the tip of our tongue, but also the middle part of our tongue as well. Because otherwise, when your jaw is always hanging open, your tongue is also against the floor of your mouth and not touching that palate, there's no stimulus for your jaw to grow. This can also cause TMJ issues or jaw pain. And part of this is because when your teeth are always apart, then they're looking for contacts. They're looking for something to touch. And this can lead to an uneven bite where your teeth are not touching the same on the left and the right side. And also with your face being so narrow, then you don't have enough room for all your teeth to come in. And this can lead to your teeth being crowded and again, throwing off your bite. And this will again lead to those TMJ issues. Now you might think, well, at least I can go to an orthodontist and correct my teeth and make them all straight. Well, what these orthodontists used to do is they try to pull everything back. So if your teeth were crowded and there wasn't enough room, they would pull out some of your teeth so that there's enough room to put the rest of your teeth in the right position. Because the only thing that really mattered was getting your teeth straight so you can have a nice smile. But people didn't realize that the effect this would have on the look of your face and also your breathing. You see, even if all your teeth are straight and your smile looks nice, if you pull everything back, then you're still going to have a receded jaw, or your jaw is not going to be fully developed. And this also means that your airway, or the ability to breathe, is more constricted. So it's harder for you to breathe. And then also what happens over time is you get this head forward posture, where since your jaw is always hanging open, it pulls your head forward, and then you get that posture where your head is protruding. So a classic example is where someone's head is forward, but their head is also tilted up. And the reason their head tilts up is to open up that airway again, to make it easier to breathe. Because when you put your head forward like this and your mouth is all constricted, then it's really hard for you to breathe. But something they teach in CPR, when you're giving those rescue breaths, you tilt that chin up first. And that again is to open up that airway to make it easier to breathe. People are naturally doing this on their own because their jaws are not developed enough. The other problem with this open mouth posture or this mouth breathing is it can lead to a lot more cavities and gum disease. And the reason is when your mouth is always open, then you're going to evaporate all that saliva in your mouth a lot faster. And also when you breathe in and out through your mouth, you're going to cause a lot more dehydration. So if you want an example of this, try fogging up a glass or something. So you probably have to just blow some air on it with your mouth, kind of like that, to make it all foggy. Now try doing the same thing with your nose. If you go like with your nose on a glass, you're probably not going to be able to fog it up at all. That's because when you exhale from your mouth, you're releasing a lot more water from your body than if you were to exhale from your nose. Now, when you're dehydrated and your mouth is always open, you're not going to have much saliva in your mouth. Now, when you don't have enough saliva in your mouth, this makes it a lot easier for you to get cavities and gum disease because your saliva is like a natural bodyguard for your teeth and your gums. It'll wash away a lot of the bacteria and the food particles. It has antibacterial components to it, and it can also dilute the acids in your mouth. The biggest reason you get cavities is because of acids. Actually, acid is literally what causes cavities. So if you have a more acidic mouth, you can be way more likely to have damaged teeth and gums. Now, if you're watching this and thinking that it's hard for you to transition to simply breathing through your nose all the time, one of the reasons could be that breathing through your mouth literally causes nasal congestion. We talked about how having an open mouth posture affects the development of your jaw and how this leads to your jaw being more narrow and also including your nasal passages. But also when you're breathing in and out through your mouth, you're breathing a lot quicker than if you were to breathe in and out through your nose. This means that you're releasing a lot more carbon dioxide. Now this is important because you don't get carbon dioxide from the air around you. You only get CO2 that's produced in your metabolism in your body. Now a lot of people think CO2 is a waste product. Now I made other videos about the importance of CO2, but I'll quickly cover it here. Your CO2 is what triggers you to take your next breath. So once the CO2 builds up in your body to a certain threshold, it will trigger you to breathe again. When you breathe quicker, then you're releasing more CO2, then this threshold gets lower and lower. That means that your next breath threshold is quicker, so you're gonna breathe a lot faster, more naturally. But your CO2 is also important because it controls your body's pH. Now, if your pH in your body gets too high or too low, then the cells in your body will die. So it's really important to maintain this pH. And if your body senses that you're losing too much CO2 too quickly, then it will try to slow this down. Now, one of the natural ways your body does this is to create mucus in your nose. It does this with these things called goblet cells. So when your body senses that you're losing CO2 too quickly, then your goblet cells will produce more mucus in your nose to try to slow down your breathing. But the problem is you're still breathing in and out through your mouth. So it's kind of like a never-ending cycle where you're still losing too much CO2 and your nose will stay constantly stuffy. So if this sounds like you and you want to really unblock your nose, well, it's going to take some time, but there is a way to do it. And I actually made a video specifically on how to unblock your nose. I'm putting it in the description below, so make sure you check that out. But for a newborn, this is really important to address early on because of how much it affects the jaw development, how much it affects the breathing later on in life. So one little trick you can do with a newborn is rubbing the tongue and then rubbing the palate or the roof of the mouth. This will naturally cause that tongue to go to the roof of the mouth. And when your tongue is against the roof of your mouth, you will naturally start breathing through your nose. Now, the way that you breathe and the way that your mouth posture is one of the most important ways to develop your jaw. Now, it's not the only thing though. There are some other things that are very important for jaw development at an early age. So if you want to learn more about that, again, I'm putting another video in the description below to check that out. Now, I want to talk a little bit about your sleep as well. Naturally, if you have breathing difficulties during the day, then you're going to have trouble sleeping. And if you're always breathing through your mouth during the day, then I almost guarantee you're going to have some sleeping difficulties. Because you can sleep all the time you want. You can sleep 8 hours or 10 hours, but if that quality is not there, then that sleep is not going to be good. When your jaw is open during your sleep, it's going to put you at a higher risk of getting things like sleep apnea or other airway disturbances. Part of the reason is if you're lying on your back and your mouth is open, your tongue tends to fall back. And when your tongue falls back, it'll start cutting off your airway. This can lead to snoring, which is another sign of some airway obstruction, but it can also completely cut off your breathing. And this is sleep apnea. Sleep apnea is when you literally start choking yourself while you are sleeping and you keep waking up in the middle of the night gasping for air. And a lot of times you don't even realize that you were doing this, but you realize it the next day when you feel like you slept like crap, or you're super tired and groggy, or you're falling asleep at the wheel. But we're learning now that it's not just sleep apnea. Even mild disturbances in your breathing while you're sleeping can cause a lot of issues that will lead to chronic inflammation and chronic stress, which will lead to some negative health outcomes later on in life. This includes damage that is linked to ADHD, grinding your teeth at night, and even insomnia. And this all can be improved if you simply learn to breathe through your nose instead of your mouth. Now, this is based on the Seattle Protocol, which is a dental way to target sleep apnea or breathing difficulties when you're sleeping. The very first step of this protocol is trying to get someone to breathe through their nose all night long. So the two ways to do this are: one, take a mouth tape. Yes, literally a medical grade tape that you rip off and tape over your lips. So the one that I use is something called 3M micropore paper tape, and also using a nasal dilator. So you can get a strip that goes over your nose that kind of opens up your nose a little bit. They also have these magnetic strips, which I think are super cool, where you put some magnets on your nose and it kind of dilates everything. I have a friend that said he started using it and he fell in love with it and he cannot sleep without it now. You can also get this internal dilator, which is like this clip that goes on the inside of your nose, and you can crank it open to help dilate your nose nose that way. All these options are good. Honestly, whatever works best for you. If you have that strip that goes over your nose and you put a lot of lotion on your face before you go to sleep, it probably won't stick so well, so just keep that in mind. But what the studies show is when people do this first step and they're able to breathe through their nose all night long, then 50% of the time, all their other symptoms will be resolved. So if you're watching this wondering like, hey, well, my jaw development is already done, I'm a grown adult, there's nothing I can do. Well, simply learning to breathe through your nose will still make huge benefits. Now, if this step isn't enough and you're still having breathing difficulties or you're still not able to breathe through your nose, again, I want you to check out those other videos in the description below, but you might also have to visit your ENT or your ear, nose, and throat doctor because of some airway blockage that can only be addressed with a surgery or something like that. Now, if you're watching this, you're probably wondering, how can simply just keeping my mouth open lead to so many other issues later on in life? Well, I hope you realize that it's not just the act of keeping your mouth open. It's that combined with your breathing, combined with your jaw development, combined with bad sleep, and all these things will add up. Our sleep is super important. It's our body's time to recover and repair. And bad sleep doesn't just mean you're going to be tired. It also affects your memory, your focus, and leads to other symptoms similar to ADHD. In children, there are huge links with mouth breathing and poor sleep and signs of ADHD and also poor performance in school. And also your sleep is important for your growth. Not just your jaw growth like we talked about, but your actual body growth in general. You get a ton of growth hormone release during your deep sleep. But if you're not sleeping well and you're restless or you keep waking up because of breathing difficulties, then you're not going to get that deep sleep and you're not going to get that growth hormone release. Now let's talk about how you can recognize mouth open posture, whether it's you or you're worried about your kid, because we learned that whether you're an adult or a child, learning to correct this will still help you. First, try a very simple check. Try to just close your mouth, try to put your tongue against the roof of your mouth, and try to breathe normally in and out through your nose. If this alone feels uncomfortable to you, then there's a good chance that you are a regular mouth breather. You can also check yourself during the day, like next time you're watching TV, check and see if your lips are open, or even ask your significant other to watch you throughout the day and see if they ever catch yourself doing this. Or you can check yourself next time you're eating and see if you're chewing with your mouth open, or you can check your pillow next time you take a nap or next time you go to sleep and see if there's drool hanging on that pillow and your mouth is super dry. Those are all signs that you are a mouth breather. The simplest thing you can start doing is to try to force yourself to breathe through your nose at all times, especially when you're not physically exerting yourself, because these are times when you should be able to comfortably breathe through your nose. Again, I want you to check out those videos below where I talk about some other exercises to help unblock your nose. But something else you can try is only breathing through your nose while you're exercising. So next time you're going out for a walk, or next time you're going for a jog, or you're hiking or cycling or something like that, try to focus on only using your nose to breathe. You probably have to tone down that workout at first, but after a couple weeks, what studies show is that your performance actually improves because your breathing gets a lot more efficient. Now, I can spend a long time on this topic alone of breathing during exercise, but I'm not going to bore you with that. So again, check out the videos in the description below because I'm going to put another link where I talk more about that specifically. But again, if you are not able to comfortably breathe through your nose and you feel like you've tried everything that you possibly could, then this is time to go to an ear, nose, and throat doctor, because this is not normal and I want you to address it. There could be a ton of reasons that led to you being a mouth breather. It could be your airway being blocked, like having large tonsils or adenoids, which are these lymph tissues in the back of your mouth. You could also have a deviated septum or like a broken nose or something like that. You could also have something called ankylosing or be tongue-tied, where your tongue is basically glued to the floor of your mouth and you're not able to put that tongue against the roof of your mouth. You could also just have allergies or a ton of nasal congestion, or it could be habitual, where you saw your parents breathing through their mouth as a kid, and then you naturally started copying them. So don't get discouraged if this sounds like this happened to you. There could be a ton of reasons that are causing this. So thank you guys for watching this video. I hope you liked it. Make sure you hit that thumbs up button in the description below and hit that subscribe button while you're there too. And I will see you guys in the next video. Did you know that something as simple as changing the lighting in your bedroom can drastically improve your sleep? In this video, I'm going to talk about how you can make these simple lighting changes, not just with your bedroom, but also with your phone and other devices, and also whenever you go outside, so that you can sleep a lot better. The main reason that light is so important